South African prisons have a high incidence and prevalence rate of tuberculosis than the general population. The risk factors contributing to this, the risk factors associated with this high incidence and prevalence of TB in prisons is the lack of ventilation within prison cells, poor nutrition, high rates of HIV infection amongst inmates, and poor healthcare services. Poor TB management strategies in South African prisons have contributed largely to the emergence of drug-resistant TB and HIV amongst inmates. This situation results in an increase. This scenario poses a great threat to the general population, as TB can be spread from the prisoners to the general population through the judiciary or during court hearings or during visits or to the other correctional services staff members. Delayed tuberculosis diagnosis and onset of treatment have contributed to the high prevalence of TB and are strongly associated with disease severity and high morbidity amongst inmates. To combat the problem effectively, robust TB diagnostic tools which reduce the delay to diagnosis are required so as to reduce the time of onset of treatment. Amongst the TB diagnostic tools that are currently used, a more recent tool has come into play. GeneXpert MTB-RIF is a real-time PCR-based assay which is designed to detect MTB and rifampicin resistance with a turnaround time of results of 2 hours. The advantages of GeneXpert over the other diagnostic tools have been assessed by Theron et al. In 2011, and they found out that GeneXpert was more sensitive than smear microscopy in confirming TB disease, and it was more sensitive in diagnosis of rifampicin resistance and in comparison to culture methods, namely measured cultures and Lewis James cultures. A recent study has shown that GeneXpert performed more effectively compared to smear microscopy and culture in accurate diagnosis of rifampicin resistance. Thus, GeneXpert is more robust and required in combating the problem. Early detection of active TB infection in prison settings will mean that there is early diagnosis of disease and before it becomes disease, and the patient can be put on treatment before the disease becomes severe. Furthermore, this leads to a reduced transmission rate of TB amongst inmates as a result of the early treatment commencement. So this study is aimed at looking at the effect that early diagnosis by expert MTB-RIF platform has on treatment outcome. Our hypothesis is that early detection of TB infection by GeneXpert MTB-RIF assay will result in a high successful TB cure rate amongst prisoners on treatment, after treatment. Our aim is assessing effectiveness of early TB detection by GeneXpert RIF assay on treatment outcome. Then our objectives are to assess treatment outcome for the patients after TB treatment and to assess the time delay from diagnosis to onset of treatment and correlate it to treatment outcomes. Our study design will be a retrospective cross-sectional study. The participants will be male and female prisoners diagnosed with pulmonary TB and treated at Pollsmoor Prison in Tokai in Cape Town in South Africa between January 2014 and July 2015. Our method is analysis of delay of diagnosis of TB treatment and onset, and analysis of treatment outcomes after TB treatment, and correlating treatment outcome to delay of diagnosis of TB treatment onset.